damaged blood to your legs by tubes called arteries. Once the blood has been delivered, the veins in your legs are responsible for returning the blood back to your heart against gravity. Veins are able to do this by one-way valves, helped by muscles in your calf that act as a pump to return the blood back to the heart. In many patients, these venous valves become weak or damaged and consequently become incompetent. When the valves fail to function properly, this causes the blood to reflux and return in the opposite direction of your legs. The constant reflux and pulling of blood in your legs is responsible for your symptoms and is called venous reflux disease, causing pain, heaviness, itching, cramping, and varicose veins. As the disease progresses, you may experience leg swelling, your skin can change in color, becoming brown and dark, and the skin texture may also change to a rubbery, hard, leather-like quality. Venous insufficiency is very common and progressive disease that gets worse over time if left untreated. It is hereditary in 85% of the cases, which means it's passed down to you by your parents. Venous insufficiency is also common in patients who are overweight, in women with multiple pregnancies, smokers, and in patients who have had to stand or sit in long periods of time during their work. The best part of this disease is that it can be treated with lifestyle changes, such as an active walking program, weight loss, and wearing compression stockings measured for your legs. Compression stockings should only be worn during the day. The simple measure can improve your symptoms, but do not cure the disease. You may have to wear your stockings for 6 weeks or more. In some patients, the lifestyle changes and compression stockings are simply not enough to provide the symptom relief to make your legs feel better. In certain patients, compression stockings cannot be tolerated and may cause excessive perspiration and discomfort. For patients who continue to have symptoms or have advanced venous disease, we can offer you a minimally invasive, state-of-the-art venous treatment procedure called venous ablation. It's in our office. This is safe and effective in treating your venous insufficiency and varicose veins and can dramatically improve your symptoms and your appearance of your legs. Venous ablation involves catheter placement in the damaged vein segment to close it and thereby preventing the venous reflux in the damaged veins. The venous blood flow is redirected to the competent deep veins in your legs that deliver the blood to the heart. One of the many benefits of venous ablation is that you can walk and resume your daily activities, including returning to work right after the procedure. As part of your consultation, you will have a comprehensive physical exam by one of our clinicians and a special venous ultrasound study that accurately identifies the location and severity of the venous insufficiency in your legs. Once you have agreed to proceed with the venous treatment procedure, a consent form will be given to you by our staff to sign. Please do not hesitate to ask any questions regarding the procedure. The day of your procedure will be offered a Xanax and medication used for mild sedation to help you relax and enjoy the procedure. If you do choose to take the Xanax, we do ask that you have someone drive you home after the procedure. The procedure takes usually about 45 minutes or less to complete. In preparation for the procedure, we start by administering a small injection under the skin of your leg with local anesthetic. We use an ultrasound machine to identify the diseased vein and introduce a small IV-like catheter into the vein. This is followed by introduction of a laser to close or ablate the diseased vein that is damaged and responsible for the blood to reflux. After the procedure, we ask that you walk for 1 hour a day for the next couple of weeks. 2 weeks after the procedure, a repeat ultrasound of the legs will be done to ensure that the procedure was successful. We ask that you wear your compression stockings for 1 to 2 weeks after the procedure. We also need to explain to you that with any minimally invasive procedure, there is a low risk of complications that can include treatment site infection, nerve irritation, which means that you may feel numbness or sensitivity over the skin, local inflammation to the treatment site, or blood clot formation that can travel to the lungs called pulmonary embolism. That is rare, with a risk of less than 1%. Please note you may need more than one treatment to close the damaged veins causing your symptoms. Our goal is to provide you with a state-of-the-art care that is minimally invasive, highly effective, and can improve the way you look and feel about your legs. We believe beautiful legs provide for a healthy and active lifestyle that can give you the confidence to walk. In a few minutes, one of our providers will be in to see you and answer any questions that you may have regarding your procedure. Thank you for your attention and have a great day.
Measured for my compression box, pictures of my legs, front and back, both legs. I'm here at Miss Bobby's today on May 25th. May 26th. May 26th, 2017. Okay, this is going to be awesome. The only thing I'm going to have to deal with is possibly, I'm just praying the Lord just take care of everything. No blood clot, no embolism. No regret, embolism. What symptoms will I see? That's the one thing I know. How do I know if there's a blood clot? What symptoms am I to look for blood clot? Because you can't always tell. There's a technician. Two of these procedures. My dad had this problem. He was in a cardiologist, so obviously there was no problem with his leg. It's hereditary. From the camps down from the parents. That was Lindsay. Back in Dr. Lindsay. I'm the vein specialist. Here in Sabi. I like to say that. In Sabi. Thank God for this stuff. People suffer. I've been suffering a long time. Today's day. So cool this morning. Overcast. Met Darren, who's the driver for Evlt transportation. Very nice man. Two beautiful grandbabies.
Hello. Are you finished with the video?
I'm finished with the video.
Wonderful. I'm Lindsay Silver.
Hi, that was you.
That was actually not me. That was my evil twin.
Oh.
she's not so evil, really.
Look like you.
Yeah, I know. All of my girls look the same. Let's be honest.
It's nice to meet you.
Good to meet you too. Now you're here for your legs, right?
Yes, I am.
Okay.
Praise God. There's I didn't know what was going on. Like, why are my legs looking so ugly? All these different colors.
Tell me what's going on with them.
They hurt. I didn't realize that the foot cramping I was feeling was a part of this.
Mm-hmm.
And then they would go numb.
Mm-hmm.
You know, it felt like something was stabbing them at times.
Okay.
And it just seems to be getting worse and worse. It's causing me chest pains.
Oh.
My lower extremities back in the 90s would just collapse. I would just fall.
Okay. You have swelling in your legs?
Yeah, all the time.
Do
I
they feel-
elevate them.
You do. Does it help?
Yeah. Yes, it does help.
Do they feel tired or heavy?
They feel tired. They feel heavy, especially when I was doing the aquatic therapy.
Oh, yeah?
I stopped it because everybody's wondering, well, where are you? I couldn't get up and walk the next day.
Wow.
So I stopped it May 12th. I had 15 sessions.
Okay.
And it seemed like it made it worse. I ended up in ER.
Interesting. What about burning or itching?
Yeah.
Both of those?
Yeah. I even had a rash, and I couldn't figure out why. I went to urgent care on Palm Avenue over in Imperial Beach where I was, and I kept having these rashes appear on my legs, and I didn't know.
How long has all this been going on? When did all this start?
I think this started, I would say in the 90s. My daughter was in 6th grade, and I'd get off work, and I would just fall down. I had no strength in my legs.
Okay.
I would get out of the car, and all this whole air would just...
How long has it been getting worse? Like it is now? Like the last couple of years?
I would say since I started aquatic therapy, which was like February, when I would try to push that water, I would get out of the water. I couldn't even stand up the next day.
Okay.
Yeah.
And then...
So I started really complaining.
So your doctor got you involved with the exercise. You're doing elevation. Any weight loss plans or anything like that?
Yeah, I'm going to UCSD Hillcrest, and I'm getting therapy there. I go to Sharp Rehabilitation. I get therapy there. And I go to aquatic therapy.
Okay. You are all therapied up, aren't you?
Yeah, and I take Plexus. I had dropped 30 pounds.
You take Plexus?
I take Plexus. Don't you just love Plexus? I take Bioplan.
No one else knows about Plexus.
No. I was telling some of the people here, and they said they were going to look into it, but they never did get it. So, or if they got it, they didn't tell me.
Yeah.
Yeah. Oh, Plexus is great.
Do you sell it?
Yeah, my daughter does.
Who's your doctor?
My daughter.
Yeah,
my daughter. She sells it, yeah. So I buy it from her.
Is she going to convention?
No, she doesn't do any of that. She just signed up. Yeah, and then, I just buy it through her to get the discounts.
Yeah.
Awesome. Yeah.
Okay, do you ever take ibuprofen?
I take a lot of medication, yeah. I've tried those, yeah.
Does that help for your pain?
Not as much as I would like to, because I used to stand and walk and carry mail for 14 years. So I would wonder why I was falling in the middle of the street when I'm trying to cross the street and bring the mail. I never understood why. But I was thin then, in my 20s.
Okay.
So a weight problem just gradually progressed because I couldn't move around.
Right. You kind of get this cyclical thing going on.
Lots of cramping back then in my 20s in my feet.
Was for a long time.
Yeah.
Can you tolerate that when I squeeze?
Yeah, I can tolerate it. It hurts.
Just checking for your swelling.
I noticed my sister had the same problem too.
It's hereditary. Have you used compression stockings?
I bought some at Walmart. I gotta keep looking for them. I cleaned up the house.
Can't find them.
Where I put them. But they're somewhere in their little box.
Okay.
Yeah, I found out about those here.
What?
The compression socks, I didn't know that there was such a thing, but I found out about them when I was coming here.
Okay.
And Solomon kept trying to ask me, why are you having heart attacks? I said, I don't know. He says, I know. It's your legs. Yeah, that's what he told me the 26th, around April somewhere, between the 18th and the 26th. He said it's the pooling is messing with my heart. I would pass out. Okay. Yeah.
Wow.
Lots of problems. And I was diagnosed with valprolex at age 35. He says, you're not going to have any more of that anymore. I'm going to get rid of that. We're going to take care of your legs,
Good.
Yeah, I'm like, good, because I'm really tired. I've had 2 strokes due to a lack of oxygen to the brain and the veins in the brain. Nothing's vein. Oh, just veiny. Just call me Mona Veiny.
Oh my goodness. Okay. All right.